All right, so we are going to demonstrate an upright abdomen on a hypersthenic patient. So we're going to do a crosswise image, and then truly most of the time you can get one image upright for the crosswise. As long as the diaphragm is relatively in the top, you wouldn't need two, but there are some patients that truly could use two crosswise if you do it upright, depending on where the diaphragm falls on the first one. So we're going to set the control panel first because that always saves time. So we're going to choose abdomen on here. It only gives us AP, which is fine, even though it's upright. We're going to be at a 40-inch SID, and on a sthenic patient, it would be 80 at 12.5. And on my patient, I'm going to go 80 at 15. So that's set when I'm ready to go. And then we'll come in here. Now, in the other video, we've already demonstrated how to change a patient and how to take history. So this is just positioning. So we're going to be at a 40-inch SID. Because this is upright. All right, so when we're at 40-inch to the wall bucky, the 40 will light up. And then we need to be, my patient is a little tall, so I'm gonna go up with that. And it's already set to crosswise. We're aligned with this. And we're in detent because we can tell. If we were not in detent, then this would not be aligned to the center of the wall bucky. So we want to make sure that we are in detent. I'm going to go ahead and place my marker before my patient comes up. So it's left marker. So this is my left side. The patient will be facing out, and the marker is going to go in the lower left corner because the pertinent anatomy in this is diaphragm, and ideally diaphragm would be up here, and then you would have abdomen. If when you shot the image, if your diaphragm was too low on that, then you could potentially need to get another image crosswise with overlap. But if it's done appropriately, a lot of times just that top one is fine because all you're trying to do is demonstrate diaphragm and air fluid levels, and air can only rise as high as the diaphragm. So this is what we're looking for. All right, so my patient is changed. He has on a gown, and we're gonna put his back against the board. Good. And go ahead and stand up nice and straight for me. Legs back a little and feet together a little bit. There you go. Good. I'm just gonna push and make sure I'm in the middle. And then central ray on this is 2 inches above iliac crest at midline. Correct? Something. So 2 inches on my hand is about 3 fingers. So I am going to bring my light down to the top of my 3 fingers. And then I move the tube, so you always move the bucky. You can put your hand down, you're fine. I lied, you were right. There you go. Okay, we're aligned. So arm down. Good. So I'm gonna just double check that. Crest, 2 inches above crest. And then this is done on exhalation so that when Andrew blows his breath out, the diaphragm will rise. And then ideally it'll be in the top of my light field. Again, the light field is deceptive. Once you put anything in between the light and the board, it automatically looks smaller. So even though it only looks like we're getting to here, my guess would be we're probably getting to about here on Andrew with the divergence of the beam. Okay, so we'll just make sure again he's in the middle. We've got left marker on his left side, and I'm going to tell my patient, when I tell you, I want you to take in a nice deep breath, and then you'll blow it all out and hold it out. Okay? All right, just look straight ahead for me. Go ahead and take in a deep breath. Blow that breath all out. Hold it out. Don't breathe. Be good. You can breathe and relax. Now, it's not common that you just do an upright abdomen, so most likely this would go in conjunction with a supine abdomen, and we did already demonstrate the supine abdomen, so this is just the upright one view. And then I would, when I'm done with everything, I would take my patient back and let him change. And that's an upright crosswise abdomen.